Hi guys, it's Suzanne Rath here, practice principal at Wellness Embodied in Cairns, and I'm here with Jazz, who has a tennis elbow. Jazz is going to, well, we think she's got a tennis elbow, we're going to assess it. Jazz is going to try really hard to not laugh during this assessment. And yeah, so we're going to start off. I've already spoken to Jazz a little bit about this, but she plays wheelchair basketball and wheelchair tennis, and you do some personal training. So do you want to tell me how many days a week you're training?
Well, I do sport pretty much every day, whether it's with school or like gym or something like that.
Yeah. When did you start getting pain?
Probably start of term 4.
Yeah. Okay. And you had injured your elbow or your shoulder, when was that?
That was in October.
Yeah.
At a basketball tournament.
Yeah. So did you have a fall, or was there a specific?
Just overuse and my muscles locked up.
Yeah.
And they were bad for about 2 weeks.
Yeah. And that's when you went for, was it Bowen? Massage? Or Emmett. Yeah. Okay, and so that helped that.
Yeah.
And has your shoulder given you any problems since?
No, but I noticed when I went to my tournament in earlier this month, this shoulder was compensating a lot for that one.
Right, okay.
Yeah.
So tell me about when you're in the wheelchair, are you always using your left arm to turn, or which do you kind of mix it around a bit while you're doing
I'm trying to use both now, especially because I've got the Fitbit.
Yeah.
So it works better.
Okay, so it will track like your arm and cool. So we'll say, just to use as an example with basketball, how often are you throwing with both hands, or how often are you ever throwing just with one?
I always shoot and throw with 2.
Yeah.
Because of how my fingers work.
Perfect. And then you propel your chair and stuff with 2 as much as you can.
Yeah.
And tennis, is this your tennis racket hand?
Yeah.
And so your other hand, you're maneuvering the chair a little bit more.
I sometimes use both.
Yeah.
But I'm supposed to use.
Okay. What were you doing when this started to hurt?
I was just shooting hoops before school.
Okay. Yeah. And what have you done since then?
Not a whole lot.
Yeah.
I do use arnica cream when it gets really bad, but besides that, not really.
Yeah. Any like tingling, pins and needles, anything strange sensations down your arm?
Yeah, sometimes I do get like pins when it gets like I use it too much. I can really feel.
Yeah. Okay. So I mentioned to you before that we're going to have a look at your neck as well, because a lot of the time we find there's a little bit of a nerve component with a tennis elbow, so we have a look at that. And also what I said to you before was with that shoulder control, a lot of, even down to like the top tennis players, a lot of them end up getting tennis elbow because they're overusing these muscles, because here is quite weak. And particularly we're looking at like your shoulder blade, like lower shoulder blade muscles, because that will hold your shoulder blades back against your chest wall. But we'll just do, because I think I did this with you last week, we do our basic tennis elbow test. If I get you to push up, how's that? Does that hurt?
Yeah.
Okay. Push this finger up for me. Does that hurt?
Barely.
Okay. So that's these extensor muscles, which do that basically with your wrist and fingers. I don't know if we can see this actually. So what I'm doing is I'm just testing, just resisting here. Yeah. And then testing, resisting here. Yeah. So these extensor muscles of the arm, they come into a pretty common tendon attachment here called your common extensor tendon, and that's the one that gets flared up with a tennis elbow. And then if we turn your hand around, so this inside part of your arm, this is the one that often gets flared up with a golfer's elbow. So that's these flexor muscles. So if we just get you, just push your fingers even up against me. So yeah, bring your fingers in and push. So that doesn't hurt.
Hurts like in here.
It hurts on that sort of tennis elbow bit, and that could be where you're holding and stuff too. So what I might get you to do is we'll just stand up and we'll come over to the mirror. I'm just gonna flick the so facing the mirror. I'm just gonna flick this around. Okay, cool. So if we have a look at, this will be good for you to look at later. Just raise your right arm out to the side for me. Yeah, okay. come back a smidge. Yeah, cool. Okay, yeah, and come back down. Yeah. All right, raise again. Yeah, all right, come down. Okay, so I will show this to you on the video later, but we can see here that your shoulder comes right up straight. So here, you start to lift here straight away. Yeah. And then you also get a nice clunk at your shoulder. But where we're actually weak is at these muscles here, because these should be holding your shoulder blade in until you get to, we'll say, maybe about this sort of range here. So your shoulder blade should be held nice and down and back here until you get to here. And then it obviously has to come around just to help you to lift your arm and stuff. But yeah, at the moment we're looking at a little bit of weakness there that we can definitely work on. And then if we look at, try and relax that arm. If we look at your left arm, so we already see the shoulder slopes down a bit. So we want it to kind of come like slope down and level out. So if you hold your arm like that, yeah. So we see here, we slope down and then we level out at the end. And we want this one to try and do the same. So sloping down, leveling out. So I'll go through all this stuff with you. But basically, that's your posture you want to have. When you look in the mirror, you don't want your shoulder blades jammed back like you're trying to do an army march or something, but you want them nicely set back. So if we look at the left arm then, so the good arm, yeah, calm down. All right, and lift again. Yeah, and down. All right, so this, where my finger is, that shoulder blade actually sits in reasonably nicely against my finger. So there's still a bit of work we could do there, but the right side, definitely we need to start getting you back through here more and probably do a bit on your shoulder so that we're not loading that elbow quite so much. But what I'll get you to do for me, Jazz, do you want to pop onto your back? Yeah. So we'll just get you to lie down there. Cool. Just pop this around again. So if we just pop that there and try and get it to sit. Actually, what we'll do, okay, just that back there. Awesome. Great. All right, I'm just going to raise you up just a smidge so that we can have a look at your neck and also have a look at some of these nerve movement tests. So you've basically got 3 main nerves going down your arm. So they come from your neck and they come right along, they split into 3 around your shoulder, like clavicle, collarbone here. And then they come down in 3 different parts. So a lot of the time with our tennis elbow, we're looking at the nerve that comes from the kind of 5th and 6th cervical vertebrae for spine. So what we'll do is we'll bring you, tell me if this gets tight or sore. Yeah. So with a nerve stretch test, and you're super flexy, which means you often need to strengthen a little bit. All right, so that's tight. Is that giving you pain? Yeah. Is that pain like you get? Yeah. Okay. So we can work on that. So just to give just an idea on here, that was tingly. Yeah. So if we just bring your arm, flip that around again. So what I've done is I've just taken Jazz's arm. Now I've also blocked, which I can't do because I'm holding the camera, but also blocked here. So I've taken her arm just back like this, and then we apply a bit of a stretch on the nerve down here, and then we come out. So that's actually stretching further than when I just did it, because I'm holding the phone, so I can't actually block it here and fully at her hand. But just to give you an idea, so if you had like full nerve movement, that would go right out to the side really easily, and you wouldn't have any pain or tingling or anything. So what we do to try and get that nerve movement back is we get you doing some like gentle nerve gliding exercises. So that releases, if you think of the nerve as like a piece of string or like a piece of dental floss, it's really thin and it can get tethered or irritated by lots of things along the way. So it can be tethered or irritated by the fact that you've got that tendon issue here at your elbow. It might be because you've got like a stiff neck. It might be because your shoulder's been a bit sore. Like here at your shoulder, you'll be really tight. Just show your face there. Am I being really horrible?
horrible.
So if I just dig my finger into your pecs, then that's really horrible, hey? So you'll be really tight through there. So that will put a certain different pull on the nerve. Yeah. And it doesn't mean there's anything wrong with it or that it's damaged or anything. It just means that it's a little bit tighter than it should be. Yeah. And we want to try and release it and try and get it moving against everything around it. I would love anybody who's watching this to comment if you have ever had a tennis elbow yourself. So if any of this is ringing a bell, or if you have any particular questions, and I will get back to you later. So let's have a look at treatment. So with our treatment, I'm going to come around this side just so we can see. So I'm going to hold at your neck here. I'm just going to get you to bring that arm out to the side. Yeah, okay, cool. Alright, is that comfortable?
Yeah.
Yeah. So just bring it to the side as far as it's comfortable, and then I'd love you just to bend and straighten your elbow. So you can rest it on the bed, but just bend and straighten your elbow out and back. So what you're doing is you are flossing that nerve, so you're not going to the point where you get any tingling or stretch or pain or numbness. And what I'm doing is I'm just having a feel here at your neck to see which like segments of your neck are going to come this way to try and protect the nerve. So that's it. Is this sore where I'm pressing?
A bit.
Okay. So in terms of actually getting this neck movement kind of normal, like if you're looking at a couple of segments of the neck, just actually mobilizing the joint and stuff, it probably only takes like 3 or 6 treatments. Yeah. But when we're looking at like strengthening your muscles too, which is probably something we should do with you, we'll progress it. But it's a good thing you work here.
Yeah.
So then you just get stuff for free. So that's all good. Cool. Do you want to bring that right arm down by your side, and let's just see what you're like on the left side? Because a lot of the time the one that's tight, that is tight, isn't it?
Yeah.
Yeah. So a lot of the time, the side that you get pain on isn't necessarily the tightest side. It's just kind of getting pulled by the other side. So that's a different type of tightness.
Yeah.
But yeah. So we'll definitely work on that. Cool. Okay, so I would do a lot more of that kind of stuff with you. Yeah. And also what we'll do is we'll get you started on some exercises to strengthen here in your deep neck muscles. Yeah. And we'll get you started on some of those exercises to strengthen your shoulder. And I'll do some work to try and just mobilize those shoulders back a little bit so they're sitting slightly further back. Let's just retest. So I haven't done a lot, but let's just retest that nerve movement. So it's going to be a bit hard for anyone to see, so they've got to just take my word for it. All right. So before, right. So that tingling.
More like sharp pain.
Like sharp pain.
Yeah.
If I take it out, it's okay.
It doesn't throb as much now.
Yeah. Okay.
It was strong.
It probably got about, so say at the start you were kind of there.
Yeah.
It probably got like about 5 or 10 degrees more.
Yeah.
Did you feel that?
Yeah.
So that's what we want to try and keep getting that little bit more. Cool. Let's get you up into sitting. So you can pop your legs over the side if that's more comfortable. So Jazz was asking me about a tennis elbow brace, which you'll see really commonly on tennis courts, surprisingly, but people can get tennis elbows from lots of different kinds of things. So say from holding like a phone or an iPad or something up and texting, or down to like just really poor lifting techniques, and lots of different things. So this is what a tennis elbow brace looks like, and what it does is it's got like a little pad that sits just below that tendon attachment. So if we pop this along here, and just shout if you've used a tennis elbow brace before and if you found it worked for you or it didn't work for you. So we put it on reasonably tightly. Does that feel comfortable?
Yeah.
Yeah. And then easiest way to see if it's going to work for you, we just actually retest our tennis elbow test again. So I'm bringing your arm up. I wouldn't test normally in this position, but can you push your finger sore?
No.
Ah, winning.
Yeah.
Yeah.
Still throbbing from before, but it's not like...
From me poking and stuff. Yeah. Okay, cool. Awesome. So we'll do a little bit more treatment on that for you now and send through some exercises and stuff. Again, I'd love anyone to ask any questions or let me know what happened with your tennis elbow pain when you had it, or what you did that worked or didn't work. Yeah. Thanks, Jazz.
No worries.
Have a great day.